Hey, Dr. Pejic.
Hello, how are you?
I'm good. You're going to join me for another Medication Monday?
Yes.
All right, excellent. So I want to talk about some medications that people may not be very familiar with, may have questions about. Today, I'd like to ask you about Deplin. So
Okay.
how is Deplin used? Is this like a normal psychiatric medicine? Is it an add-on?
Yeah, that's a good question. So Deplin is the brand name for L-Methyl Folate, which is a vitamin that acts as a cofactor, meaning you need it to make other factors, which are neurotransmitters. And neurotransmitters are things that help your mood out, help you focus. And the main ones we think about when it comes to Deplin is serotonin, norepinephrine, and dopamine. Um, so Deplin was actually, I guess, created or produced by a company on the North Shore of New Orleans, here in Louisiana, by I believe a pharmacist at some point who created this company. And over time, they did some research that showed that if you add L-methyl folate or Deplin, as it is, to someone's regimen if they're depressed, that they got better. There's some evidence that women who are overweight did well on it to help their depression out. But also, many people walk around with a genetic mutation where they don't manufacture as much L-methyl folate in their bodies. So this is where Deplin is different than typical medication. It's one of those things. It's a supplement actually, and it's a B vitamin, and it's a kind of an activated form of folic acid, which is vitamin B9, and that's essential for your brain to function and your body to function. So,
So if
yeah,
L-methyl folate is something that your body produces on its own, how do you know if your body's not producing it or if it's not producing enough?
that's a good question. We can check your folic acid levels, which I'll typically do if I have somebody with depression. We'll check that at least one time in the very beginning when I meet them, and then if their folate is low, you can supplement with just folic acid, and anyone can buy that over the counter at a CVS or a Walgreens or a pharmacy. So we don't actually test the L-methyl folate levels themselves, at least I don't here. However, I do check genetic testing, which sometimes shows that somebody has a mutation from mom and a mutation from their dad. And if you have two of those folks can produce L-methyl folate at a lower rate. And so we kind of assume that that's the case for them, especially if they're depressed and their antidepressants not working. And you can think about this, antidepressants help raise neurotransmitter levels in your brain, in certain areas of your brain. But if you're not making enough neurotransmitter in that area of your brain, then you can't raise them, if that makes sense.
Mhm.
Or it might be harder to raise them. Deplin kind of acts as a different pathway to raise a neurotransmitter. It's the way I would look at it. So I like to say it's like killing one bird with two stones when you have an antidepressant plus you have Deplin together. They can work together to have a better response for folks. And the other good thing about it is it's not medication per se. Like people don't think about it being made in a lab, and they like that it's more natural. They like that their body's already making it, and it's just a supplement.
So is it something that could ever replace your antidepressant medication?
Um, I wouldn't go as far as to say that, but I certainly have had patients where like they get they have a bout of depression, they go on for a while on an antidepressant. Maybe I add Deplin on, and at some point they're saying, "Hey, this antidepressant really helped me out, but I'm in a relationship now and I'm having libido side effects. I'd like to taper down on it." And in those folks, sometimes we'll taper down, and if they're stable and they don't become depressed again, we will taper it off. If that person happened to be on Deplin, I might keep the Deplin on by itself, especially if they have the genetic mutations for the MTHFR gene. It's methylene tetrahydrofolate reductase, MTHFR, is the name of the enzyme. It's a mouthful. And if they have that mutation, I will continue the Deplin. And sometimes we continue to anyways. I mean, another supplement we often kind of use is like fish oil, omega-3 fatty acids. That can help with mental health and mood and like focus. So it's kind of the same thing. If you're prone to depression and you weren't on an antidepressant, but you wanted to have some coverage and like support your brain health, you could certainly take these types of supplements.
All right, last question.
Mm-hmm.
For someone who's been taking medicine for a while, been in therapy with depression, they haven't had labs done in years. Is this something that they should get checked?
Yeah, I mean, that's the problem in medicine to some extent, or maybe even in psychiatry is, and I've had this where patients have been in therapy for years and I see them and I go, listen, have you gotten your labs checked ever? Have you ever gotten your vitamins checked? And they haven't, and no one suggested to them that they should see a doctor or go do this. Now, I'm certain therapists advise their patients to go see a psychiatrist. And an astute psychiatrist will always rule out medical things first, will then rule out substances that could be causing problems like, alcohol or marijuana, cocaine, that type of thing, and then rule out medical problems that could be causing their problem. And there's several times I find folks have low vitamin D, low vitamin B12, or perhaps they're anemic. They have like iron deficiency anemia, and they're complaining of fatigue and they're depressed, but it's partly due to just being anemic, which is a pretty straightforward fix for many people.
So it all works together.
Yeah. So we like to be comprehensive and very thorough, because these are folks' lives and their brains are connected to their bodies, and sometimes they just need that detailed approach if nothing else is working.
All right. Well, thank you. That's really valuable information.
Sure. Happy to help.